Andrew Cuomo of New York, who knows a thing or two about trying to manage through this crisis. Thanks for being on the show this morning. I want to ask you about that, but I first want to get an update on how New York is faring, where we stand, and what hospitalization rates are looking like right now.
Thank you, Mika. New York is doing remarkably well. We're seeing states all across the nation with the virus going up. New York has one of the lowest infection rates in the United States of America, believe it or not. We went from one of the highest to one of the lowest. So all our numbers are good. Our hospitalization rate is going to be down again today. We test about 60,000 tests per day, which is more than any other state, more than any other country per capita. So we got that testing up. We do it religiously. We watch the rate, and we calibrate our reopening by that rate. So the reopening is happening all across the state. We have different regions at different points, but they're all moving forward. We're now worried about increasing our transmission because people from other states might come from New York. You want to talk about a 180-degree turn and a cruel irony. That's where we are.
Yeah, and it's going to be a long haul from what we've heard. We've got Dr. Fauci, I guess, testifying today. We might get more information from him. We know in Florida, people are asked to quarantine when they travel to Florida. Are you considering the same for New York? Where do you stand? Because New York has obviously tons of people who travel all the time.
Yeah, we are seriously looking at that because, where do we go from here? Our rate is good. Our rate is stable. As I said, it's one of the lowest in the country. We have to make sure that doesn't tick up because people don't get sloppy or undisciplined. But we also have to make sure we don't raise that rate by having people come in from other states. And that's something we're seriously considering, that if you come in from a state that has a high transmission rate, you would have to self-quarantine or we would have to test you because that we don't want to see that happen. But, because so many of these issues come back to the same point. We tested the theory that the White House put out, right? They said just reopen. And they took a very political stance, in my opinion, to the entire issue. And we see what happens when you just reopen without science, without metrics, without data. It wasn't good for public health. We lost people we didn't need to lose. And it wasn't good for the economy because those states that reopened in a rush now see a boomerang. And their economies are slowing, and the stock market is nervous about the virus going up, and they may wind up closing again. So we tested the president's theory, a political reopening. COVID was a political issue. It wasn't. It was a virus. You had to be smart. You had to use science. And those states that used science are doing much better than those states that made this a political issue. That's a fact.
Mm-hmm. You're dealing with a lot as you sort of try and get your arms around this crisis and continue to do so. There's been the ongoing reports about the thousands of deaths in nursing homes in your state. There are people who are claiming, you were negligent with the situation, especially at the height of the epidemic. I'd like for you to respond to that. But also, I'm just wondering, looking back, are there measures that were taken too late or measures that could have been taken that we learned through the process?
Yeah, look, you have now the Republicans trying to point fingers because they don't want to admit the total reality, which is the federal government was asleep at the switch. Why did New York have so many cases? Because when they were saying the virus was coming from China, they were 100% wrong. The virus had left China. It went to Europe. We got the virus from Europe. They actually traced the strain back to Europe. Nobody in the White House, not the CDC, not the NIH, nobody said, watch the people coming from Europe. We had 3 million people come from Europe and land at JFK, our airports, between January and March before they did the European travel ban. So they totally blew it, and they want to point fingers. On nursing homes, yes, people died in nursing homes all across the country, every state in the nation, because this virus affected older people in congregate settings. If you look at New York's percentage of people who died in nursing homes, we're number 35 in the nation, Mika, 35th state. in terms of percentage of deaths. So there's no fact to it, but they're doing what they're doing, which is playing politics.
Hey, Governor Cuomo, Willie Geist, good to see you this morning. Appreciate you coming on. Tamika's question about lessons learned over the course of this process, though, looking back now with the information you have, was it a mistake to issue that March 25th order to send people back into the nursing homes now that you have all the information you have?
First, it was federal guidance that was put out, Willie, and what the federal guidance was saying, which the health. Yes, but following the federal guidance. No, it wasn't a mistake, because if you look at the facts, not that anybody looks at facts anymore, by the time you didn't want to leave a senior citizen in a hospital for 2 weeks if they didn't need to be in a hospital bed for 2 weeks. You didn't want to use the hospital bed that way, and it's very dangerous for the senior citizen to be in a hospital for 2 weeks, sepsis, secondary infections, etc. By the time a person was transferred after 9 or 10 days, they were no longer contagious. And what all the data says is the reason you had infections in the nursing homes were because the staff brought in the infection. And you look at the communities that had the high infection rate overall, those are the communities that had nursing homes with a high infection rate. So it is that the staff got infected, they came to work, and they brought in the infection. Now, how do you fix that in the future? I don't know that you really can. We have mandatory testing for all nursing home staff. Twice a week, we were testing nursing home staff. Take their temperature when they walk in. But it's very hard. All you need is one person, an air conditioning repairman, a delivery person. And once that virus gets in the nursing home, it's fire through dry grass. And it's not just nursing homes. You look at the people who died from COVID, over 80% are senior citizens. That's where this virus preys. But in terms of learning lessons, look, there's going to be books written on lessons learned. How did this happen in the first place? How did this virus get to this country with nobody knowing and with us doing nothing? How did it get to Europe and get to America and no one said anything? We had no testing protocol. We had no tracing protocol. We have no public health system. We have private hospitals. There's no public health system. And that's why you see these places like Florida now being overwhelmed, because there is no way to manage a pandemic in this country. So there's plenty of lessons to learn, and it's going to start with what the federal government should have done and when they should have done it.
Yeah, Governor, we've documented for sure the federal failures throughout this. But as you look now at the fall, and some experts have said there will be a recurrence in the fall, that this could come back in places like New York City. What do you take from these, let's call them 4 months of every day, every hour, intensely focused on this? What did you learn? What would you do differently that you can apply if, God forbid, it does come back in the fall?
Well, we're preparing for that. First of all, Willie, the testing is key. And everybody said it was key. It was just too hard to accomplish. And the federal government ran from any substantive responsibility all through this thing. We're doing about 50 to 60,000 tests every day. So if there's a tick, we're going to see the tick. Then stockpiles for PPE. It was ludicrous that we're all running around trying to buy masks and gowns, and China was the manufacturer for all of them. All the testing reagents. We're implementing what we call Surge and Flex. Every hospital has to be coordinated in a system, and you have to be able to share patient load, et cetera. We have a database of 60,000 emergency healthcare workers who could be brought in when you're getting overwhelmed. So just having that whole operational system in place. But I can't stop the virus from coming in over our border. And that's where we have to get a federal government that either knows what it's doing, or the World Health Organization, or whoever is the watchdog that stands on the wall and blows a whistle when the virus is about to invade a state or the country.
Governor Cuomo, Susan Del Percio has a question for you. She used to work for you, full disclosure. Susan.
Good morning, Governor. It's great to see you again.
Hi, Susan.
Hi. One of the things I know is that you are also always looking towards the future, not just how we're going to come back in Reopen New York, but how we're going to make New York better. And one of the words you kept using in your briefings was reimagine. We saw that about 10 days ago when you talked about the police force and how policing can be reimagined. I'm curious, what else do you see in the future, what your administration is looking to, whether it be in education or healthcare? It seems like there's a lot of opportunity here.
There is. Thank you, Susan. First, I want to punctuate what Mike Barnicle said. Good for him. This is a special moment in society, and there has been a beautiful voice of outrage. Finally, this nation has stood up. Is it related to COVID? Is it related to the sense that we're out of control, that COVID gave all of us? I don't know what started it, but it's great. But you have to seize the moment. They talk about carpe diem, seize the day. Carpe momentum, seize the moment. It only will matter in history if we actually take this moment and change. How do you reform the police department? What does it look like? What do you mean defund the police? What do you mean demilitarize the police? And in New York, I'm forcing the local governments to reinvent their police departments in this moment. But beyond the police department, reimagine education. We went to this immediate remote education, remote learning, because we were forced to by COVID. We weren't really ready, but we've learned a ton. How do we institutionalize that? Telemedicine. Again, we were forced to do telemedicine before we were ready, but we learned a lot. In terms of public health going forward, how do you run a transportation system when you're worried about a disease and spread of a disease? We're now disinfecting the subway cars. These cars are cleaner than you have ever seen them. There were years where you couldn't get homeless people off the subways and newspapers, and now we're disinfecting them, literally. They've never been cleaner. So there's a whole raft of issues we can learn. Also in New York, this is the time to build. We've been talking about infrastructure forever. The economy now needs a real adrenaline shot. People need jobs. Now do the construction you've never done. Every president has talked about it. Trump was going to do a $3 million infrastructure program. Get those airports built, get those tunnels built, get those bridges built. And we're doing that in New York also. But again, to Mike's point, this is a special moment. Someone like myself who fought for change all their life knows that change only comes when the people stand up and demand it. But you have to then be ready to actually have the program, have the legislation, so you take that popular energy, put it together with progressive government policy, and that's TNT. That's political dynamite. And that's what I'm working very hard to do here.
Governor Andrew Cuomo, thank you very much for coming on the show this morning. We really appreciate it.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.